Hello, guys. Welcome to the YouTube channel Health Q. This is the live Q&A session for Friday, and today we would be going to talk about knee osteoarthritis. So, some of the tips and pain management methods I would be talking to you. Mr. Weber is there online. Hello, Mr. Weber. So, yeah, so osteoarthritis is a very common problem, commonly seen in elderly age group of people. But as the time is going by, thank you, Mr. Shailendra. So as the time is going by, it is getting more common in people day, day by day. So and answer those queries to you. Okay, so I think there are not much questions. Let me start talking about osteoarthritis. So the most commonest form of arthritis that a human race experiences is osteoarthritis of the knee joint. The reason being is the structure of the knee joint. The knee joint is a kind of structure that is in our body which is responsible for a lot of movements that is incorporated whenever we pain as less or else as minimal for people as possible. Now, if you look at what happens in osteoarthritis, so there are two things that majorly happens in osteoarthritis. One, the fluid that is present inside the joint, which is called as the synovial fluid, right? So this reduces in its quantity. Secondly, the joint space between the joint is reduced due to lack of synovial fluid. And even there is something called as cartilage which surrounds the bones of the knee joint. This cartilage also gets wear off. Okay, so due to this wearing off of cartilage and also due to lack of synovial fluid in the knee joint, what happens is and the surface become rough and there is pain. I hope I'm audible. Please let me know if I'm not audible to you guys. I will try to talk with little more high volume. I'll try to talk a little more louder. Okay, so I am suffering from Bell's palsy since 6 February. I've taken medicine as per doctor's instruction for 10 days, taken advice from neurosurgeon since 2 months, doing exercises as suggested by the doctor. Okay, Weber. I think there's something more in this. So that. Yeah. So I'll meanwhile continue about osteoarthritis to the knee joint, which gradually becomes so hard or so more that it is very difficult for a person who is suffering from osteoarthritis to do this his day-to-day activities like walking, standing. You must have seen your grandparents at home or else elderly who are at your home complaining of knee pain that happens mostly when the knee joint, right? So this is an uncurable solution in a way you can say, but the good news is it is very easily manageable. And if you are looking for information is a sign of wearing cartilage, my 828, to an extent yes, but not necessarily. uh, Clicking sound mostly happens when the kneecap bone is getting friction between your knee joint area. So this is abnormal or else wrong positioning of the kneecap bone. In medical terms, this problem is called as patellofemoral syndrome. I've made videos on that as well. Please watch my YouTube playlist on knee joint. You will get a lot of information and even how to correct it. Be not possible due to lockdown. Okay. So first thing ever, Bell's palsy takes 3 months of time of recovery. Second thing, if you are taking medications regularly, that is more than enough. Third thing, the electro treatment, the stimulation that is done for Bell's palsy has to be continued only to the point when there is no muscle contraction present, like when there is complete paralysis. So initial days when there is no movement happening on your face, at that time you need to take the electrophysiotherapy. Later on you have to focus more on exercises only. So what I would request you, make sure to do enough for you to get better recovery. Still you have got time for your recovery to happen, so just don't worry. Hope that answers. Yeah, Ravindra, can you please repeat your question? I didn't got your question quite well. Okay. So meanwhile, I'll be talking about osteoarthritis as well. I was talking, or else to the synovial fluid that is happening to the knee joint. So the first and the most important thing that a person who is experiencing knee pain or else who is suffering from knee osteoarthritis should do or focus on is weight loss. Because if weight is more pressure constantly falls on the knee joint, right? And this increases the chances or is the rate at which the cartilage damage happens. Hence it's important that you should do weight loss regime. It could be exercise, diet control, whatever you want to do, but make sure your weight is under control. Second thing, if you are a female, plus you are having more weight, plus you are having needs proven in research studies. So that's why weight loss is very important aspect of controlling the knee. You do hot fermentation because it's a chronic problem now. It's not an acute condition. Ice massage will not help you out. Better go for hot fermentation. Okay, so the first point is weight loss. I've made an extensive video on my YouTube channel showing some of these simple, easy, and still you can burn some calories for sure. Okay, so that is first thing that you need to do for osteoarthritis, and that is weight loss. Knee joint strengthening with the help of physio ball. Sure, I'll try to make that. See, you don't need a physio ball in order to strengthen knee joint first place. As I mentioned, I've made one video on weight loss exercises, and I've even made video on knee strengthening exercises at home. If you do that, it's more than enough. Physio ball is just one prop. You don't have to depend on just one prop to do this. There are many props that you can use that's present at your home to strengthen your knee joint. Make sure to watch those videos. It would be really helpful. And yes, I would try to make videos with physio ball as well. Give me some time, I'll come back with that. So yeah, coming to the next point, and that is food consideration. So there are three. So first, very important component of knee joint is glucosamine and hyaluronic acid. Now there are very few dietary sources for that hyaluronic acid. If you are experiencing knee pain, knee osteoarthritis, osteoorthopedic surgeon can easily prescribe that to you, and you can start taking that on a regular basis. If you are taking considering calcium intake, make sure with calcium, vitamin D3, and B12 are also an important aspect of muscular and bone strength. So yes, you need to take those supplements sometime, but make sure to see an orthopedic surgeon or else a doctor. Take their prescription and then only take it. Just don't randomly taking, because too much of calcium, vitamin D6, B12 is also not good for the body. Consider is first the food that is rich in omega-3 fatty acids. So these foods are basically, I can give you an example. Again, I'm not an expert in that space of giving you some dietary advice. Make sure to consult a nutritionist or else a dietitian. And if you want to get some advice from a dietitian, I would try it. If you want, then I can connect you guys to a dietitian. I can bring her on board and she can do a live video session interacting with you and letting you that will help me out in giving getting that feedback, and I will be coming back with a nutritionist on board who will try to answer your food related questions. Now, coming to the second important food supplement, and that is gamma linolenic acid. Basically, pulses, nuts are the food basically which are rich in gamma linolenic acid, and it's also important. And the third, I'm not the specialist in that space. Coming to the exercise part, which is the most important aspect of physiotherapist's job, and this is something where we have a lot of knowledge about. So let me talk to you about some exercises. Yeah, Weber is asking something. One more point: water drop continuously happen while reading when or taking food. Kindly advise. Please continue doing eye taping, eye drops, which has been prescribed by your doctor. Don't stop that. And I've made a video on eye taping. Make sure to do your eye taping, especially when you are sleeping. Mostly what happens when we sleep, if our eyes are not getting completely closed, they will irritate and there would be more of dryness, which causes this water dropping happening. Okay, so you need to prevent that by taking good amount of lubrication, giving good amount of lubrication and protection to the eyes. So patching or eye taping plus you are having mild to moderate level of knee osteoarthritis, you can very well manage yourself with physiotherapy alone, exercises alone. You don't need to depend on any kind of surgery. Best way is whenever the pain is more, you can take some electrotherapy modalities to reduce your level of pain. Machines like IFT, TENS, ultrasound, laser. These are the machines physiotherapists use in order to reduce your pain levels. But nowadays, there are many TENS unit, ultrasound units, knee pain, or any kind of muscular pain. It helps you out in dealing with pain. But again, remember, electrotherapy modalities are not a solution that will cure your osteoarthritis. It's just meant to reduce your symptoms level. It will not cure. So whenever you have more pain at that time, sorry, my baby is suffering from spastic diplegia (CP). Okay, Arch. Can you just ask what exactly you're looking for from this question? So next week onwards, I'll be creating some videos on spastic diplegia. Sorry. Bell's palsy complete 28 days and body aches cause weakness and sleep is excessive. Okay. Due to COVID, we are not going for physio. Yes, Arch. So that's what's my topic that's coming next week on what you can do for physiotherapists. Physiotherapy in a video which would be uploaded on this Monday. You can do those exercises yourself at home for your baby. So make sure to watch that video on Monday. You are doing passive movements. Sure, you can continue passive movements. Passive movements is not enough to manage your kids' physiotherapy sessions without physiotherapist. So please make sure to watch this video. Mr. Ravindra is asking, Bell's palsy, total 28 days are done, body aches and weakness. So, body ache has no relation with Bell's palsy. You need to then check with your BP levels. Sometimes BP is high shooted. At that time, you can experience the symptoms of body ache and weakness. There's something that is definitely apart from Bell's palsy that you are experiencing, due to which you are having this body weakness, and understand why this is happening. She has fear of grouping. Got it, Arsh. There are a lot of things that you can do at home. I would be sharing that, so make sure to watch that. What's the age of the child? Arsh, can you tell me the age of the child? She's 4. Okay. Got it. So there are few things you. The second thing that you should focus on is raising the body with weight on the hands. So activities like crawling, active foot, but give more of sitting practice to your child. You can use a bolster, you can use a stool, you can use your lap, these kind of things into standing practice. This is also very gradual. You cannot immediately start making child stand and expect that the child will start standing immediately. No, it has to go very gradually, but that will happen. It might take some time, but that will happen. So make sure to continue doing that. About the exercise part, so I was talking about some machines, ultrasound, IFT tens, and as I said, there are pocket tens that are easily available in any pharmacies. You can buy that. If you don't want to take the help of machines, hot fermentation if your pain is chronic, and if your pain is fresh, then go for cold pack. That's the best way to reduce your pain level at home. Apart from that, what you should also do is you should also focus on some of the knee strengthening exercises. But starting before strengthening exercises, make sure you have got good mobility. Whenever osteoarthritis is there, there are a lot of knee related restrictions. So first make sure that you do proper knee mobility exercises. So knee mobility exercises for you to bend. Don't go beyond that. So just making straight and bending, making straight and bending. These kind of activities you should do on a regular basis. Also, make sure to stretch your leg muscles well. Stretching your hamstring muscles, stretching your calf muscles, stretching your foot muscles. All these things should compare to other benefits you achieve. So the mantra is mobility exercise, that is normal range of motion activity only. But if you are able to maintain these three things, I can assure you, you do not need surgery at least for next 20 years. Scissoring gait also, ma'am, I get it, it will be there. That's what I'm telling. You have to go step by step when it comes to management of cerebral palsy. First, to sit directly, the ability of the back muscles to sustain the body. Once you are able to achieve that, then you can start with, to prevent the scissoring go worse. It's okay. You have to gradually teach your kid to do the side active movements, but do stretching of your child, stretching of the foot. I have made a video in which I've shown how to do the stretching for the legs. Make sure you do that. Make sure to do active assisted exercises for your kid. Active assisted exercises are what you tell baby or else your child to do a movement. You just help the child to do that movement, but ask the child to bring some effort and incorporate play into that. Kid is a small child, right? He is a kid, it's a child. He won't understand those commands of lift a weight, lift your leg, move your leg. They will not. So videos on this video on this, so make sure you watch that. It will be more helpful and more informative than this. Anthony is like, hey, did you answer my question about my ears? Why is my right ear now is weaker than my left ear? Because I had Bell's palsy a year ago. Should I go to hospital? Okay, so this is very difficult to say why your right ear nerve is weaker than your left ear. Maybe the possibility is you would have got ear infection on your right side. Right now, whenever there is infection, there is inflammatory response that happens, which leads to certain level of damage to the nerve, and that's why this nerve will be more weaker compared to your right side. What you can do is, if you don't have much of symptom, definitely decide. So yeah, you can go to a hospital, but this is not the right time to go to a hospital since COVID thing is on. It's better to be safe at home. Today's topic is about cerebral palsy, Arsh. Today I'm talking, sorry, today is about osteoarthritis. Now, instead, do stretching of the legs, stretching especially for the calf muscles, for the thigh muscles. So, spread your leg. Ravindra Verma, throat pain also, ma'am. Yes, Ravindra, then this is not anything related to Bell's palsy for sure. Bell's palsy will never give you body. It would be that you would be suffering from some secondary infection, maybe some viral, or else maybe some other health issue which is causing this. New with osteoarthritis info. So what I was talking about is, thank you, Anthony. Thank you so much for this. You have to do exercises that's focusing on three important things. First is mobility exercise, hamstring muscles. This is something that is required in order to achieve better and long term results for us. One is the basic, that's called as neuroparesis, which is usually it recovers back. Sometimes it is neuropraxia video that's on coming on Monday. So I am planning to do this stay at home treatment series since most of us are in lockdown right now. They Second, on Wednesday, we would be having an proper video where I will be demonstrating facial muscle exercises for Bell's palsy. That would be a live session basically, where we would be doing the exercises together. 2 days back, you can see this mark here, the scar. Yeah, that's because I had a fall, but I'm much better now. The stitches have been removed and ये प्रॉब्लम होती है कि कंप्लीट रिकवरी नहीं हो पाती है। इसका ये मतलब होता है कि मसल्स में जो स्ट्रेंथ आनी चाहिए थी वो नहीं। सिनकाइनेसिस बहुत तेजी से डेवलप होगा, थोड़ा ज़्यादा टाइम ले सकता है सिनकाइनेसिस। इसलिए अगर आप दिन में 2 बार एक्सरसाइज कर रहे हो तो मैं आपको सजेस्ट करें, उस मूवमेंट को रिपीटेडली करते रहें। ये हेल्प करेगा आपको, आपकी जो मसल्स की जो मूवमेंट है उसको रीगेन करने में। अगर आपको लगता है वीकनेस ज़्यादा है, तो आप थोड़ा-सा रेजिस्टेंस ट्रेनिंग भी दे सकते हो। जैसे फॉर एग्ज़ाम्पल अगर आपको लगता है आपकी स्माइल इस तरफ से थोड़ी वीक है, तो आप थोड़ा-सा हैंड का सपोर्ट लेते हुए और फिर स्माइल करें। I think my screen will go away if I share the link right now. What I'll do is in the description, I'll add all the videos which I've mentioned about. Video description of bells. Really honored to help you out. Yeah. So on that note, end this video here. Thank you.